Hi there, my name is Jessica Leonard, and today I'm going to be discussing precautions during pregnancy. I'm going to start by entering the room, close the door behind me, perform hand hygiene, and introduce myself. Hi, my name is Jessica. I'm your nurse today. I need to get patient's name and date of birth, get those two identifiers for the patient, and I'm going to proceed. Today I'm going to be going over precautions to keep in mind during your pregnancy. I'm going to start with food. So some foods you want to pay close attention to and avoid, let's go with the ones to avoid, are raw or undercooked meat. The reason for this is there's a bacteria or two or more that can occur with raw or undercooked meat. Listeria or salmonella can enter through the placenta to the baby and cause some developmental issues like seizures, blindness, or paralysis. Another one you want to watch and avoid is fish that has high mercury in it, and those are going to be shark, mackerel, or swordfish. High mercury is going to affect brain development, and that will affect your baby's neurodevelopmental progress and can cause issues there. Let's see, a third one would be caffeine. So high caffeine intake is going to cause a low birth weight, and it can also lead to preterm labor. So now let's move to medications and supplements. So I'm gonna start by saying there are some safe medications for you to continue taking. On the good list are antacids like Tums. And if you have a pain or fever, you can do Tylenol, which is also known as acetaminophen. And of course, your prenatal vitamins are safe. They've been prescribed to you by your healthcare provider. So those are all good stuff. You want to avoid ibuprofen, or also known as Advil. You want to avoid those that can cause birth defects. That's the reason you want to avoid those. You want to avoid acne medicines, specifically tretinoin or Accutane. Those definitely have been proven to cause birth defects. Some ACE inhibitors for those of us with high blood pressure, you definitely want to have your healthcare provider review those before you continue taking those. Some supplements to avoid would be saw palmetto. I really wouldn't just go for any new med or any supplement without having your healthcare provider review that first. Let's see, some environmental precautions that you need to take would be, you want to avoid excessive heat, particularly like a hot tub, jacuzzi type thing, or a sauna, and even just really, really hot weather, excessively hot weather in a desert or something, because when you overheat, you're going to get dizzy, and your blood pressure can drop, as well as you can go into labor because of excessive heat. Environmental factors, let's see, pesticides, no good. So you want to avoid pesticides in your own garden or backyard, or if it's part of your hobbies, you want to maybe postpone that or have somebody come in and do that part of your gardening, because that will pesticides have been proven to cause some disruptions in hormones, and so that could cause like a preterm labor, and we don't want our pregnancy is very hormonal. We don't want to have disruptions there. The last thing I can think of is lead. You want to be careful to avoid exposure to lead, and that is typically found in older homes when you're doing like renovations and things like that, like tearing down walls and things like that, and asbestos being in older construction. So you really want to maybe postpone those kinds of plans or move away from the project while it's being done, and you can return when no longer pregnant. Okay, so those are going to be my precautions for you. I want to also talk about when is it appropriate to get dental care. So it's generally safe to go to the dentist second trimester, and you can still get x-rays, but you need to make sure that you have the proper I don't want to call it PPE, but it's protective equipment that the dental office will put over your body to protect you from x-rays. You really have some dental changes go on when you are pregnant because of the hormonal changes. So yeah, you can continue to get dental care. I don't think I would recommend going under for a dental surgery, but regular dental maintenance should be fine during the second semester. Lastly, let's go over travel. Again, that's going to be something safest through the second semester. You want to make sure to bring your medical records with you in case something happens while you're away from home. People can understand what your situation is, your history is. You want to stay hydrated. You also want to, if you're taking a flight or in a car, you want to limit the flight or car ride to less than 5 or 6 hours, because you don't want to be sitting so long. You want to have compression socks on to avoid blood clots. Okay, and we definitely just don't want to be traveling long distances or being away from your primary care in your third trimester. I definitely would not suggest travel after the second trimester. Okay, do you have any questions or concerns or comments for me? Okay, we'll go ahead and wait for your doctor to enter the room and continue your appointment. I'm gonna do hand hygiene, and I'm going to exit the room. I'm going to chart the education provided. Thank you.